it's your girl Be2Fly and I'm back. Okay, so welcome back to my channel. This video is going to be probably short and sweet. We're going to be discussing my IVF journey. I haven't given you an update because there's been so much going on. I've had a few people reach out to me with concern on some other platforms, and they want to know, how's my journey going? How is everything going? And I just was not able to record a video because it's been a lot. So to catch you guys up, just in case you're just now joining, this is your first time watching one of my videos. First of all, thank you for coming. I hope you stay, click that subscribe button and just stay a while and be my friend. Okay, so this video is talking about my IVF journey. As you all know, I have been going through IVF for going into a year now. Started off with IUI. That didn't go well, and I believe the main reason that didn't go well because I had some issues that I already knew were of great concern. I've been diagnosed with endometriosis, adenomyosis, and I have fibroids. So, and you might not believe it, I'm 40 years old. So I will be 41 this year. So it's just a lot going on, and I knew some of this going in, and I went to a doctor. The main thing I believe was a factor in this process taking as long as it has. I went to a doctor where we didn't have a good rapport. There was not a good connection, and I kind of felt that from the very first visit. And it just, trying to go to a provider that looks like you think, okay, everything is going to be good. Everything will they will work out, they'll listen to you, they'll understand you more, and it wasn't the case. Like the bedside manner and everything was good, just the medical aspect of it, listening to me, telling them what works for my body, what I know, what I've already been through, that did not go so well. So I had to stop in like November, December, and find another doctor who will actually listen to me and heed what I'm saying. You know your body best, I know my body best, I know what I go through. So after that, we had 2 failed IUIs. Then we started the IVF journey. So to speed this along, we did the retrieval. We end up with 18 eggs, 8 fertilized, and I have 1 embryo and baby that's frozen right now that's waiting to be transferred. So we couldn't do the transfer right away because doing one of the ultrasounds, they saw the saline ultrasound, they saw that I had a fibroid, actually 2 fibroids in my uterus. And because of the fibroids, if we do the transfer, it might implant on one of the fibroids, and then that will cause me to have a miscarriage. So I had to go through a procedure, myomectomy, to get the fibroids removed. And while they was doing a vaginal myomectomy, and I did a diagnostic lab so she can look at the uterus and make sure there was no issues with my endometriosis, adenomyosis, nothing else would be of concern. But of course, there was something going on with one. I have a hydrosalpinx on my left side, which is an issue with the tube. To better explain it, I have a hydrosalpinx where on my left tube, where basically it flushes back and forth. Normally, when like sperm or whatever goes up into the tube, that tube closes off and it stays inside to mature the egg. So because my tube flushes, doesn't really close, that allows fluid, sperm, whatever it is, to go back and forth throughout the tube. So there's no guarantee that the egg will get fertilized with the sperm, and there's no guarantee that I will get pregnant. So, and I was informed that there is a 50% chance if I keep that tube, if it's doing that even through IVF, I still might suffer a miscarriage, might not, the embryo might not implant. So all of that. So we get to the day of surgery, and I just could not record a video because it's just so much going through your head. This is a lot of, they tell you, one of the main things while you're going through the process is to be stress-free. But just about everything that you're doing while you're going through this process, it's stressful. It stresses you out. So you're basically trying to keep everything in your mind and in your life separate. I'm like, I'm gonna deal with IVF over here, I'm gonna deal with work over here, I'm gonna deal with family, I'm gonna deal with the relationship over here. But in the end, everything just starts combining and colliding together. And I'm not sure how you do with it, but for me, I just have to go into myself and just meditate and just try to bring a positive energy back to myself so I can continue on with this process. Some of my other IVF warriors might know what I'm talking about, where you just have to block everything out and focus on you. So that's where I am right now. The surgery did not go as planned. The plan was to go in, take out the two fibroids, block off that left tube, or remove the left tube, and just clean up any endometriosis or anything else that they found in there. So of course, once she got in, now I'm out for all this, so she informed my partner. Once she got in, she had good news and she had bad news. So I'm like, okay, here we go. It's always something. It is always something. Like, why can't it just be as easy for me as it is for everyone else? That's what you think. Okay, so I have some pictures for you. This is going to be graphic, so if you don't like seeing intestines, blood, any of that, you might want to look away right now. Okay, now this is going to be a little graphic. Okay, so once she got in, basically, and I'll post the photos up. I don't know if you're familiar with adhesions. Sometimes, like after you have a surgery or something and you start healing, things would adhere back together, or they just stick together with like a thin form of skin, I guess, basically. So everything in my abdomen is formed together, adheres together in one big ball. So so the next few pictures, you can see like my stomach, some intestines, and basically the inside of my abdomen. Everything is basically adhesed and stuck together. On these pictures, you can see where my intestine is stuck to the wall of my my abdomen, and here you can see the fibroids, and at the bottom you can see the fibroids when they're removing the fibroids. And these are the final pictures where everything is removed out of my uterus. My stomach is stuck to the wall of my abdomen, and everything is just one big ball. In this photo, this is supposed to be the left side of my, I'm not sure if you guys can see that. This is supposed to be the left side of my abdomen, where you're supposed to be able to see my tube, the left tube. But of course, she couldn't even get to it because everything was so close together and just stuck together, and she didn't want to touch anything because right next to that you see that is connected to my bowel. Okay, so where we are now in the process, I've had the surgery. I've been on I was actually okay the first after the first like 4 days. The first 2 days I was really, because I think it was more from the anesthesia. The first 2 days I was just out of it. I was still in pain. I was bleeding really heavy, and I was just nauseous and sick and throwing up. And I'm not a person that likes to take medication, so I took a half of the pain pill that I was given and some nausea medicine, and I just stayed in the bed to let it all get out my system because the anesthesia I could not even leave the surgery center because I couldn't walk. I was still throwing up, and it was bad. It was a long day. And something that was supposed to take like 30 to 45 minute procedure ended up taking like an hour and a half. So it was just a long day, and I'm just ready to get to the next chapter in this journey. But as of right now, the next step for me is to, and now that they have the fibroids removed, I have to make sure that they got everything out, because as you know, just because you remove some of the fibroid, once they start cutting or maneuvering or doing anything to that fibroid, it can go up in the uterus, it can kind of shrink, and they're not sure if they got everything. So now I have to do another HSG test to make sure that they got all the fibroids out, make sure that the tube, maybe it was just how the doctor did that test, make sure that tube is not going to affect anything with implantation. If the new HSG test and ultrasound show anything, then she recommends I go to do another surgery with a specialist who's able to go in and remove the tube and cut everything loose, basically. And I really don't want to do that. So it's either that or just take the chance of having the baby implanted and just see if it sticks. And I'm kind of really leaning more towards just seeing if it works. Because at this point, we spend thousands of dollars. It's been very stressful. And I don't know, I might just need to take a break. For a minute. Okay, so this is not going to be a sad video or anything. I'm gonna go ahead and wrap this up so you don't see any tears or anything, because I don't want to be that person on YouTube crying. Sorry. So we're just gonna wrap this up and stay tuned. Hopefully everything goes well with the exams on my next cycle, and hopefully in May we can just transplant and transfer the embryo and go from there. All right, guys, thank you so much for watching. Thank you for staying tuned. Thank you for encouraging me. Thank you for just being with me on this journey to bring life into the world. If you're also on this journey, baby does to you. God bless. Thanks for watching, and I'll see you next time.